And now we're joined by our contributor, David Clement, who has more on a recent and developing trend of Canadians crossing the border to bypass long wait times for medical services like MRIs. David, all yours.
Thank you for that. Lingering issues have plagued the Canadian healthcare system for years, and one that has recently gotten much worse is wait times for diagnostic scans like MRIs. Canada has one of the lowest number of MRIs per 1 million people at just 10.35, ranking near the bottom of the OECD. Japan, who ranks number one in the OECD, has 5 times more MRIs per capita at a rate of 57 per 1 million people. And for wait times, the Canadian healthcare system is really struggling. For non-emergency cases, the average wait time is over 16 weeks or 113 days. Now, one Canadian-owned business, CanMax Medical Imaging in Buffalo, New York, has said that business is booming with Canadians crossing the border to get scans more quickly. Earlier, I spoke with their president on what is driving this trend.
So really, we're seeing that the patient demographic that's coming down to us for MRI and CT is quite broad. It ranges anywhere from patients that have existing malignancies that they're doing follow-up to screening protocols to our sports patients that have sports injuries or personal injury clients, whether it be work or an automotive accident. And so I believe that the drive in that, and we know that the drive is essentially the wait times that are currently being presented with in the province. We understand that the health system, of course, is under strain with our growing population, and unfortunately, they are doing their best in trying to conform to that by adding more MRI, by adding more CT, expanding the hours at those facilities and hospitals or other outpatient independent health facilities. But nonetheless, there is still that need for MR and CT services. And so we're seeing that patients are becoming fed up with the long wait times. I mean, we've seen in some areas in Western Ontario, waiting up to 293 days for an MRI. And so they're coming down through us. They see that we're Canadian. They're proud to support a Canadian corporation, but still reap the benefits of the US health system where really there is no wait time. And so for as low as $700 Canadian plus HST, we do charge HST on our services, but for $700, you're getting a detailed diagnostic MRI by a subspecialized radiologist at one of our 5 centers in Buffalo and the surrounding area.
While some critics have argued that this trend is worsening the haves and have-nots, CanMax's president disagrees.
And that's a very good point. I'm glad you raised it. And we did see a comment from the president of the Ontario Medical Association about creating a divide between the haves and have-nots. And really, our initiative is beneficial to all patients, to all individuals, seeing as those the haves, if you will, are capable of removing themselves from the queue, paying privately, and going down and having their scan. Those that do not have the means to do so essentially move up in line. And so there's really a universal benefit to going over the border, crossing the bridge, and getting your MRI done and getting out of that queue.
And now this begs the question, if Canadians can go to the US to pay for care, should they be able to pay for that same care here in Canada? Back to you.